And our first witness is not here. So we're going to move to the and our second witness is not here unless he's on. Okay. Kelsey, you're going to get to go first. Nope. So welcome to Northeast Kingdom Day in the State House. And Kelsey, I am glad that you made the decision to stay in the kingdom today and not make 2 trips to Montpelier in the same week. Our first witness is not in the room, so Bonus, you get to go first. Right. So thank you so much for being here. And folks, I'll let Kelsey introduce himself, but we'll do I think I'm going to wait until the second witness. We'll do introductions because I think we'll have more of our committee present at that time. So go ahead, Kelsey. The floor is yours.
Great. Yeah, I always love being down in person, but I'm also feeling a little under the weather, so don't want to share that with you all. So glad there's a virtual option. So thank you for having me and hosting folks for NEK Day. My name is Kelsey Stavseth, and I'm the Executive Director of Northeast Kingdom Human Services, which is the local community mental health and designated agency, also co-president of the Vermont Care Partners board. And so just want to take a few minutes to talk about what's happening in East Kingdom related to human services. And we've got some folks who are going to speak to some other things happening in our area. But the first thing that I really wanted to highlight is that the Northeast Kingdom is 2,000 square miles and covers the 3 counties of Caledonia, Orleans, and Essex. Essex is the most remote county, and one of the challenges that we face is that remote nature and just having access to services. And so just want to highlight, knowing Vermont's a rural state, but the Northeast Kingdom is the rural part of a rural state. But one way we overcome this is through partnership and collaboration. And so I really want to lift up what the Northeast Kingdom has done through community partnership. And so a little while ago, the hospitals, the FQHCs, and now designated agencies that are becoming CCBHCs are required to do a community health needs assessment every 3 years. A little while ago, we got together and said, why are we all doing this separately? Can we do it together? And so Northeast Kingdom Human Services, Northeast Vermont Regional Hospital, North Country Hospital, Northern Counties Healthcare, Northeast Kingdom Community Action, Northeast Kingdom Council on Aging, and the Vermont Department of Health all came together to do a regional community health regional needs assessment. And so one reason this was really helpful is that when we're looking at prioritizing the needs of our community, we have one source, so to speak, that we can all refer back to when we have to decide how to spend scarce resources on the most important things in our community. That community health needs assessment raised up 4 different areas that were most important: mental health, social determinants of health, chronic disease, morbidity and mortality, and substance and alcohol use. And so not only do we do a community health needs assessment, but we also have an accountable health community that meets every month. The backbone is NVRH, but that gathers the organizations that I listed and more. They come together monthly to tackle the issues highlighted by community members. And so I just wanted to highlight the collaborative nature of the kingdom, not only because we believe in that, but because we have to. Again, there aren't so many of us over here, but I do think in some ways we're leading the way in how to collaborate, how to use the regional supports that are in our area, and how to make an impact in our community. And so just, for our organization, the designated agency, we do mental health for adults and children. We support individuals with developmental disabilities. We do emergency services. And so when you hear that, we want to focus on providing those treatment supports that are associated with mental health. We think about therapy, case management. But I had mentioned before the social determinants or contributors to health, and saying the folks that we're working with, yes, can have underlying mental health issues, but sometimes the root cause goes beyond those issues. And so just to give you a better understanding of some of the underlying tensions that can contribute to mental health or other challenges, saying 18% of the people that we work with have had their utilities turned off in the last few months. 24% say they have transportation issues. 8% say they fear for personal safety. 10% have difficulty accessing childcare. 37% say they have financial hardship. 20% are food insecure, and about 20% are housing. And so, again, why we talk about the collaborative nature in the kingdom is that, yes, there are associated anxieties, depression, early intervention issues that we're working on, but with these underlying issues, we're often tackling problems in the family system. And so we have to rely on each other to make that happen. A couple other things that I want to highlight quickly too is saying that one of our goals is to be innovative and saying we're not functioning in a bubble, saying what are the most pressing issues facing the kingdom and Vermonters. So we talk about education reform, we talk about healthcare, we talk about public safety. And so we are certainly involved in all of those. Two programs that I want to highlight. One is the Front Porch, which we've been having for a couple of years, but have recently just fully operationalized. So we have 4 crisis stabilization beds. This is in Newport, Vermont. And then we have a 24/7 walk-in for mental health and co-occurring issues, substance use, and PS services. We've also partnered with the St. Johnsbury School District to start a collaborative program. This is unique. We use Success Beyond 6, which has been around for a long time. But what we've done to change it is that we've built a collaborative program in town and Kate owns the building, but the school runs the school and we provide the therapeutic options. So this is a small pilot program, but we are preventing kids from needing independent therapeutic placement out of district, which can be expensive and also has high transportation costs. And so this keeps kids in the area, allows them to transfer back to participate in the public school, and we think is one way to help address rising costs associated with special education. The last thing that I'll note is that in partnership with our local other healthcare partners, we have used our expertise to help embed suicide-safe pathways in hospitals and primary care, and that's through our emergency services program, and specifically named Josh Burke as someone who's dedicated a lot of time working with our partners to improve how we address people with suicidal ideation and how we support them, not only when they show up at organizations, but also beyond that. So I know I only had a few minutes, but just want to say collaboration and community coordination is one of the strongest things we've got going in the Northeast Kingdom. And I think we have a lot to offer in terms of how we're addressing some of the healthcare costs, education challenges, and other issues facing Vermonters across the state. So thank you for having me. I appreciate it. And it's good to see everybody.
Thank you, Kelsey. I hope you feel better. And I think we were pretty impressed with the front porch. What did you just call it? What is it?
Front porch. Yeah, we call it front porch.
Yeah, the front porch. Last year when you testified around the public inebriate or detox kind of situation. So thank you for being here this morning. And we're going to flip back to Carrie Stoller, which is going to precede Siv's pantry. So kind of fits in, I think.
Wow. And NBRA, actually.
Yeah.
Productions not. We're all
Yeah, I was just going to say, we're all here now, so we're going to do introductions around the table and around the room, okay? So my name is Teresa Wood. I live in Waterbury. I also serve Bolton, Buellscore, and Huntington.
Ann Donahue from Northfield, also serving Berlin.
Good morning, I'm Dan Noyes. I represent Wolcott, Hyde Park, Johnson, and Belvedere.
Hi, good morning, Eric Duval. I represent Rockland City.
Brenda Steady, Westford, East Milton.
Everything, everything, Brandon. Morning, my name is Eustace. I live in Guilford and represent Vernon.
As Rachel of Hartford. Jubilee McGill, and I live in Bridport and also represent Middlebury, New Haven, and Woodbridge.
Hi, I'm Ray Garofano. I represent Essex and Essex Junction.
And then we're gonna start right here on the windowsill and go all the way around.
Oh, Amy Lester, and I'm here, I live in Plainview.
Great, welcome. Lori?
Very much committee assistant.
Erica, Sutton. Crystal Bigelow, a community health worker at VRH. Carolyn Town, Director of Substance Misuse Prevention at VRH. Lisa Walton, community member of Comfortably Well.
Great.
Marion Tatum, I'm a community member and retired pediatrician from Derby.
David Financial, community member from West Charleston, Vermont.
I'm Rebecca, I'm from Barnett. I'm Julia Demas, I work for St. Johnsbury Community Health and I live in West Barnet.
Good morning, Brianna Houston, NVRH Substance Misuse Prevention and Vermont National Guard Counter Drug Program.
Nancy Bowers, Director of Early Childhood and Family Services at NECA, serving as our PCCs, Dulce, and early intervention.
Katie Foster, I'm an Associate Director for Family and Community Engagement at NECA.
I'm Stephen Hickey. I'm from the Northeast Kingdom. And I'm associated with the local mill site in Barton. And I'm here to see democracy in action.
Great. Well, it's wonderful to have so many people from the Northeast Kingdom here. Oh, did I miss? Okay, this is the first I have to say. On the floor.
Sorry.
That's okay.
Amy Solomon, yes, and I'm here with the food bank. I also represent the PCCs and the CAP.
Okay, great. Thank you. I didn't see you come in and sit down. So Carrie, welcome and please introduce yourself. And I'm just, letting folks know that we have an amendment on one of our bills that we have to hear this morning. So we're going to try to adhere to our schedule pretty succinctly. So appreciate your comments and we'll look forward to connecting with you in the building as well. But we are going to need to kind of be brief.
Got it.
Thank you.
Good morning, I'm Carrie Staylor. I'm the Senior Manager of Government Affairs for Vermont Food Bank and a resident of the Northeast Kingdom. I live on the Linden Kirby line. And I'm actually here, Kelsey did a great job of talking about a lot of the connectedness and collaboration that I was going to discuss in my testimony. So I will simply build a bridge between Vermont Food Bank and the Northeast Kingdom. Vermont Food Bank has been involved in the Northeast Kingdom for a number of years. We were a founding member of NEK Prosper, which is the Accountable Community for Health at NVRH, and are still members of that leadership team, working collaboratively with all of the organizations that Kelsey mentioned to think about all of those root causes to, poverty, to food insecurity, and to, health in that region. We are also a member of that community at North Country Hospital, which is a slightly different version of Accountable Community for Health. And one of the things that I want to just highlight for this committee that Kelsey also mentioned is that challenge of transportation. We see that through the food bank. Part of our work is logistics, moving food around the state. It is particularly challenging in the Northeast Kingdom. We do not have as many partners per square mile in that area. And so, and it also lacks a lot of real community hubs, right? It's hard for people to get even to St. Johnsbury or Newport, which are really far apart, even though we talk about them as though they coexist. That's why we have to rely on rural partners like Sid's Pantry, who you'll be hearing from next, the Gilman Senior Center over on the New Hampshire line. Island Pond has NECA location. NECA is an incredible partner. They also operate Newport and St. Johnsbury food shelves that we rely on to help get food out to community members. And then a little bit later, you'll hear from the community health team at NVRH. Those are our site partners for that Caledonia County Veggie Van Go, which used to be at the hospital. They're under construction now. So we've added a partnership with Vermont State University at Linden, and have added a walk-up option for students to come and get produce from that event. So really that collaboration piece is critical where we live and where we work. And I think you'll hear that a lot better from the partners who are here today than you will from me. So I'm gonna cede the rest of my time to folks and welcome Denise to the chair. Thank you.
Thank you so much, Carrie. And I do want to highlight what Kelsey said, and it impacts everybody else who is following it. And that's the collaboration on the state, I'm not sure exactly the title, but state health plan, each region needing to do a health plan,
Community
a
health
community
assessment.
health assessment. And I was delighted to hear all of those organizations who all have requirements to do the same thing do one plan, one assessment, and then how they implement those needs could vary by what their role is. But having one assessment for the region, I hope that other places do that. I don't know that they do, but you serve as an example, so thank you.
Yeah, and that I will say, we've talked about data with this committee before. That is data that the food bank uses to identify gaps and opportunities. So we too utilize that data that those organizations are collaborating on, and it is really, really helpful to us to have all of that in one place as opposed to, 7 different ones to check.
Exactly.
Yeah.
Thank you.
Yep, thanks so much.
Welcome, Denise.
Good morning. Good morning, committee. I thank you for allowing me to speak today. I'm Denise Walton, and I'm here today as a resident and community member of Concord, Vermont. I'm also an advocate for our local food pantry, Sid's Pantry, which is housed at the Concord Health Center, run by Northern Counties Healthcare. Sid's Pantry serves approximately 60 families of all ages. It's a monthly pantry and it's held along with the past offerings of an additional veggie drop, a lunch pop-up style in the summer. And all of these projects have been made possible with Vermont Food Bank programs and/or grants, and many volunteers who gave their time. I'm here today to ask you to fully fund Vermont Food Bank's request for the $5 million budget in FY27. With $2 million for the Vermont Feeding Vermonters program, grant program, $2 million to support Vermont Food Bank network food shelves and meal sites, and $1 million for ready response food access in emergencies. In my community, we have a population of almost 30% 65 and over. Most live alone and have limited local family. We are a very rural area with no public transportation and a small convenience market, but no grocery store, unless one travels to New Hampshire or St. Johnsbury. The current population is approximately 1,669 people, with 16.9% at poverty level. It is a perfect community partnership for Sid's Pantry to be located at the Concord Health Center. Food access is available during health center open hours, and patients and residents of Essex County get a referral to the pantry. Produce, which is always of the highest quality, comes from Vermont Food Bank and our monthly pantry drop, and it's supplemented with our Vermont Feeding Vermonter grant, which is used to purchase fresh food from local farmers, eggs, cheese, milk, dairy, and it's all supplied, and also it's supplied by Vermont Food Bank with our monthly deliveries. Each month, the shelves are stocked with staples, rice, pasta, canned goods, and always applesauce. These are ordered and paid for through various grants. Our community itself is very generous. During the year, we have a big food drive at the Concord School. Miles Pond Association donates at the end of the summer as they head out and empty their summer camps. And the health center sponsors a turkey trot. And we have a local group that bakes bread for the holiday baskets. This is all part of my community, our community, and part of many communities in our state, within our state. As we see many more in our communities are focusing on these projects of survival. We are proud, we are humble, and in our current status, we are in need. We ask that you please consider funding the Vermont Food Bank budget request. Lastly, I will talk about ready response for floods, ice storms, and emergencies. I myself have experienced one of these emergencies on November 1st of 2025. With the government shutdown, there were no EBT benefits paid out to anyone. As an elderly disabled person, I qualified for EBT. With a tiny window of prior knowledge and preparedness, I was able to grow my own sprouts, make soups, and make do. The store was vacant that day as I entered to get with my 2 ingredient list. I saw the shelves piled high with things that I could not have. Fresh veggies were wilting as there was no one there to buy them. The meat department bulged with its load. That feeling, it ignited me. I made do, but the families, the kids, our elders, and our veterans, would they make do? Could they? In response to this federal emergency, 1 week later, Vermont stepped up. and helped its people so we wouldn't have to make do. Elders could have more than tea and crackers for dinner. Kids could go to bed with a full tummy. Thank you. I thank you. We thank you for the action you took as legislators to ensure those of us who needed help in November got by were able to have our benefits or money to buy groceries, and food shelves were able to continue to supply to their neighborhoods. That support was critical. That showed people like myself that you also believe that poor folks, we do not have to suffer. We do not deserve to suffer, and we deserve to ask and have choices of fresh, healthy foods and safe, adequate programs to access these foods. I recently was surprised to learn that each month the Vermont Food Bank and our partners serve an estimated 70,000 people across Vermont with 14 million pounds of food delivered. 222 farms are supported by Vermont Food Bank, and 217 network partners shared food with neighbors. In closing, it is with gratitude that I am here today and ask you to please consider full funding for the FY27 for the healthy well-being of the residents of our communities of Vermont. Thank you.
Thank you so much, Sid. And thank you for sharing what it was like on a personal level in November. We weren't in session then, but the legislature acted, and I appreciate really hearing what it felt like out in the community at that time. Thank you so much. Yeah. Next, we're going to hear from the hospital. We're going to hear from Crystal and Erica. And you're welcome to be there together. And for anybody who actually had prepared testimony, if you haven't already sent it to Lori, would you please send it to Lori Morse so we can post it and every other people can read it, because it's really helpful and important to inform what's happening out in our communities across the state. So thank you so much. Welcome.
Thank you. Thank you. Thank you for your time this morning. My name is Erica. I am a resident of Sutton, Vermont, and I'm a proud community health worker at Northeastern Vermont Regional Hospital. This is my coworker, Crystal. Hi, my name is Crystal Bigelow. I'm a community health worker at NVRH. I'm a resident of Linneville and proud voter in my community. And thank you.
Good to hear.
Yes, and navigator with Vermont Health Connect also. Thank you. My supervisor, Deb, and I are site coordinators for the Vermont Food Bank, Veggie Van Go Drop, Vermont State University, Linden. We happily facilitate that with the food bank. And my role there is to help coordinate the volunteers to the food distribution. Deb does traffic and data collection. We have acknowledged an uptick in anxiety and concerns about food insecurity from consumers picking up in the Veggie Van Go line. At our Linden drop, we are serving 350 to 400 families per month in that line. We're seeing a very diverse population. People are expressing that they're picking up more shares just to help their friends, family, and neighbors. We hear words of gratitude towards our volunteers at the food drop and excitement for the variety of foods that are being given out there, the hardiness of the foods during different times of year. Two older Vermonters get particularly excited about the beets and eating them and canning them. There's
beets?
Beets.
Oh, that's what I thought. Okay.
There's one gentleman that says each time, "Thank you for your service. Thank you for your time here." He's very thankful for us. We're seeing an increase in community partners volunteering alongside of us. We just had the probation and parole is there the last few months with us, helping out. So we're seeing different community partners come and join us to help and see the food insecurity that our communities are expressing. We also have a local agency that has partnered with the food bank to have a food drop at their housing site to more directly serve those of their population that are experiencing barriers to get to the food drop. As community health workers, we work to help connect families to resources and that to help address their needs, such as food insecurity. We frequently refer families to commodities, Veggie Van Go, food shelves, and even connect to schools that are, that we're collaborating with, that also collaborate with the food banks so that, families can access food that way, which addresses the transportation barrier as well. We're seeing kids, so touching families where they're at. Working with families, we would like to share some stories, of experiences that we've had, with community members that live among us and serve as a community health worker. I had received a referral from a provider at one of our local primary care offices for a woman asking if we could purchase her a glucometer to help manage her diabetes. She was struggling to do so. So we met with her and we kind of went through the intake and just talked more about what her need was. And in conversation, she shared that within her community, she was actually at the laundromat and sharing with her peers that she wasn't receiving food benefit, and she didn't understand why, and her peers believed that due to, as they're comparing incomes, that she should be eligible. So we discussed that. And I also believe that maybe she should be eligible. And she actually believed that due to her race is why she was not receiving benefits, because her peers at lower incomes, higher incomes, similar incomes were receiving benefits. So we reached out to the local economic services. Turns out there's this little checkbox that you have to check on the application that she missed. So they didn't screen her for the benefit appropriately. So we redid the application, which she was really joyful about to learn that she was going to be receiving the benefit. And the intern actually said, "Thank you for your support. However, I don't need funding to buy a glucometer. I know how to eat balanced meals. I didn't have the resources to do so." So that gave her the ability to access balanced meals to help control her chronic illness. Yeah. And because of that connection, she also believed that maybe that meant she couldn't reach out to other food networks, and so hadn't. So we had a great conversation around the accessibility to being able to do that. It's really great. And I have another story to share with you all. We're seeing an increase in those experiencing financial insecurities due to the high cost of living, and things such as increased healthcare premiums in Vermont. A 36-year-old single teacher walked into our office looking for help because she was losing state and federal tax subsidies to help cushion the cost of her premium, her affordable premium at the time. That means this teacher earning a little over $30 an hour is above the income threshold for Vermont Health Connect and is no longer eligible for help to pay for her monthly premium. She would now be responsible for a premium above $1,300 per month. With rental costs so high, she would be paying out half her gross income for housing and healthcare alone. Patient was crying in my office, wondering how she would be able to afford food for the month. Scenarios like these are happening almost daily in our office, in our community, and statewide. The ability for consumers to access low barrier food resources such as Veggie Bingo programs out of the Vermont Food Bank are essential resources to help cushion the high cost of living. Thank you for your time today.
Thank you. So people were so succinct and followed so well that we have some time for questions from the committee, for if you don't mind, for any of the witnesses who came this morning. So I have one. And so when you say community health worker, does that, I mean, I can envision what that means. Are you a social worker? Are you a nurse? Are you, just trained in community supports and services? Could you explain a little bit what that means?
Yeah, thank you. Great question. We are neither a nurse or caseworker. A community health worker is a standalone role. There is a movement and efforts. We do have a community health worker association in Vermont, so we're taking the steps to
Be recognized as a profession?
Yes,
Okay.
absolutely. So I think that NVRH in the Northeast Kingdom, there's large support for what a role of a community health worker can do. We have that time, especially in the medical side of things. We have more than the 15 minutes that a provider does at an office to really look at the social determinants of health for each family and determine what their needs are and help connect them to those resources and services, really appear with the people that we're connecting with.
Great, Representative Steady.
So who's your employer? Who do you get paid through?
Yes, absolutely.
So that's 5 million?
It is not. We
Okay.
are employed through Northeastern Vermont Regional Hospital. I don't know the details around the funding.
Yeah, that's fine.
Some of our funding does
okay.
come from the Vermont Blueprint.
Yeah.
Yeah.
I don't know all the details, but I
That's
think
okay. I just didn't know.
we have a small section of funding that comes from Vermont Health Connect. We are part of that. There's a very little that is handed out from that, but.
Yeah. Getting smaller every day. Representative McGill.
Yeah, so you, in some of the stories you shared, you talked a bit about like helping folks navigate the various benefits. Is that something you find a lot of people needing assistance with?
Absolutely. In
Yeah.
our office, we have a walk-in option, so we can receive referrals. People can walk in, people can call. So we have a high flow of traffic of people walking in saying, I need this is an issue. I don't have food security, don't have financial security. Where do I go? I've heard this morning a lot about collaboration. We can't do it alone. We have to be educated about what our community offers and collaborate with all the resources. Many and some of what you see sitting in this room with us. So, yeah, it's an honor to be able to hold that role and help connect and collaborate. We do still have a walk-in door, so we're like one of 5 in the state of Vermont that people can just walk in without an appointment to get our services. We have 3 community health workers and a lead, and we initially do a full intake. So we ask all of those questions, right? And sometimes we share something with them that says do you have any other questions? And we oftentimes I tell people often that if they're not sure who to call, give us a call. And if we can't connect you to someone, we can help you in our office. So either way.
Great. I have a question for Denise. First off, I wrote down projects of survival. That feels like that's kind of like a mantra here in this building this year. So if you hear yourself,
I noted that.
if you hear yourself quoted, then you'll know that. Thank you. Thank you. I'm curious. It seems from what I've heard from other food pantries, food shelves, local. Some people have rebranded themselves as local markets. That there seems to be, I guess, especially as the food insecurity appears to be rising in the state, more formalization, I guess, of these community resources. So locally, I know that you have to fill out an application. They're taking down information where, in the past might have been a little looser. Do you know what I mean? Is that something that you do at your food pantry, or do you know about what's happening in, the other local communities?
It probably depends on which role someone is taking on, a volunteer, specifically where we just work with the general public. We don't have background. You have a board, so there's different roles and different levels. So I think I'm seeing a lot more of a collaborative. People are helping people and they're wanting to. And, we do have to be careful. People do want to donate things. We've had a gentleman that had come one time with a whole truckload of bread and to donate to Sid's Pantry and to community. And we just have to make sure. I mean, we can't call it, but we do. We try to deal with good quality foods and things. We have recalls, there is some sort of, with the Vermont Food Bank, they're wonderful recalls, so we can check things, we can let people know.
Sherwood, did you need neighbors?
I did. I meant community members that might be coming in to receive food
So when people come to Sid's to get food from you?
Yeah, we have a
Do you have a
basic form that, what county do you live in, your address, and they don't even have to do their address. And if we have people that come in that aren't from Essex County, we'll say, yes, we're here today, but this funding is, specifically for Essex County. Here's a list of resources, and that's where that collaborative comes in. We can send them here, there, and everywhere, and we allow people to pick up, for other people, because that is a barrier with the transportation. And that's why some of those things like bringing the veggies from St. John, having them there, people could get them there. At least they could get to the Concord Health Center because they know where it is.
Thank you. Representative Steady and then Representative Cole.
So the $5 million, can I get a breakdown sent to me of where that all goes? Salaries, food?
So Representative Steady, we're going to hear about that during FY27 budget
Oh, okay.
testimony, okay? Okay, so then Representative Pohl and then Representative Donahue.
Firstly, thank you. You are on the front lines and filling in the gaps where other areas of marketing or the government has failed us, basically. So, I mean, thank you, bottom line. But my question has to do with, it's pretty striking, that one checkbox, how big of an influence that had on somebody's life for quite a while, and a ripple effect, really. I was working at a senior center doing EVP type applications as well with folks. And I only learned halfway through my time there that there was a specific form that could be used to expedite for seniors. I don't know, I just want to make sure that you all are aware of this too. But it was, I mean,
It's a little bit shorter ABT SNAP.
Exactly.
Application, yes.
Totally, but it just goes to show like what, in terms of administrative barriers, what can we do? Maybe we can have input to influence, why somebody missed that checkbox or whatever. So love your insight on that.
I think one thing we're finding is everybody's in a hurry, right? So if we can get them in there, like they come in with initial ask. And sometimes that initial ask is like, I need housing. Right, but we need to have a financial conversation before we can help you get into housing also, right? Because we gotta break down some more barriers first.
We try to take a look at what somebody comes in with a need, that's what's important to them, finding housing or another need might be important for them, but we all work in what's important to us, so that's where we have to focus. And I think having the opportunity to have someone to sit down with that's familiar with an application and the process is a highlight. It's incredible, when just as an example, with Medicare open enrollment, people, we aren't educated in Medicare and people were flowing through our doors. Not having that one-on-one support, it's crucial to have that.
And where did you refer them?
So we have Council on Aging. They were completely booked up in our area, so it was Medicare directly. And that was not an ideal. Not ideal, so. Yeah. So I think just having one-on-one support with having that offered. I know in many cases, people are handed an application to go fill it out on their own. How can we offer them that support?
We can help them fill out those applications in our office, like the 205 All Med, for the people on Medicare. Yes, it feels good. So we can provide that support to at least help them fill it out.
And I'm going to restrict myself just for a quick question. Just because we have, a wealth of experience and information here. So one of the things that I know we have coming before us in FY27 is a request from community partners for, I keep wanting to call them explainers, but that's not what it's called.
Navigators.
Yeah, they're kind
That
of.
was my question about,
assisters.
yeah.
So, when you were talking about that one-on-one assistance, as the Medicaid changes come into play, where people are going to have to apply twice a year, they have to, prove a bunch of different things. Are you seeing a need in the community for more support to assist? I'll get the assister thing in there.
Yes.
To assist people to understand what these new federal changes mean to them personally.
We have about 175 assisters in the state right now, and there's like tons of people on board to get that education right now. They just did a training for like 300 people in one part of the state.
Who did the training?
Vermont Health Connect.
Okay.
Offered by Vermont Health Connect. So that's fantastic to have everybody on board. And we have collaboration with different assisters in the state. So that's nice. We're not alone, but also it is going to be a burden on us to, at that increase of traffic, anxiety for people. That's going to create a lot of anxiety. Right now, I have to provide my income more than once a year. People, refer to like tax time. That's once a year. So I get all my stuff together. I figure that out. I think it's going to bring great knowledge to people about their income and changes, right, that are coming or that have happened. So that's good. Or like people that want to move monies in different areas. So I think it'll be good, but I think there's going to be a lot of anxiety and concerns that comes with that, which is going to turn into a lot of traffic, phone calls, to try to suppress some of that.
And we have 3 community health workers in our office, where all 3 of us are assisters with Vermont Health Connect. And over a third of the work that we do is insurance with Vermont Health Connect, Vermont Medicaid, qualified health plan. So already that's a third of
It's a big part of what you do.
Yeah.
Representative Donahue. Representative Donahue?
Yeah, thanks. Just, and this might be anybody who might generally know this is based on what I've seen happen in my town and so forth. Wondering if you have a sense of how much of food access is able to be delivered through people making choices, saying this is something I would use, this is something I wouldn't use, versus, a box of items and this is your.
I got that one. Okay.
Because I know the administrative burden is far greater to try to individualize, but,
Yes and no,
Yeah,
right?
okay.
To get the volunteer labor together to pack a box of food and
Oh,
then
okay.
distribute
Yeah.
those, which are heavier, bigger, harder for people to carry, back into their own house. That's a challenge. And at Vermont Food Bank, we recognize that is literally what people are asking us not to do, right? People want to make their own choices. They want to be able to walk into a food shelf. I think the real challenge comes when food shelves and food pantries and meal sites are not the grocery store.
Mhm.
We are not a replacement for the grocery store. We don't want to be a replacement for the grocery store. That's why programs like 3 Squares are so critical. They give people that dignified choice of the whole spectrum that's available, as opposed to, what we are able to access and distribute and what our food pantry partners are able to stock on their shelves when sometimes they're in a little tiny corner of a parent-child center, where it's like you can go once a week or maybe once every 2 weeks, right? And it's just meant to fill the gaps.
Yep.
And to fill an urgent need, as opposed to offer really broad variety of choice. I will say that is where some of the events like Veggie Van Go come in, because a lot of people want more access to fresh food. It's a riskier purchase, right? It might spoil. You might not get a good one. It might not be available, right? And so having those things, it's more expensive, right? Having those things available at no cost to people is helpful and helps to fill that choice gap. But we do operate programs where we're required to give people a box, right? The commodity supplemental.
Yeah,
food.
Right, and I
Has to be
understand that.
about-
I was just wondering very roughly how much food access is able to be through one form or the other. That's.
I would say mostly it's by choice. There are a few partners that we work with who only do food box programs, because that's what their
capacity is.
Yeah.
I want to extend my sincere gratitude to everybody here this morning and making it down from the Northeast Kingdom, a beautiful, beautiful part of the state where I have lots of family. So I spent a lot of my childhood in the Northeast Kingdom. So I our whole committee greatly appreciates you being here and sharing the community that you have there and what it means to be part of that community. So thank you so much for being here.
Thank you.
Great.
Yep.
Okay, committee members, we are going to transition now to hearing an amendment on H 545. And we'll just let sort of the room kind of dissipate a little bit. Representative Burt is here to present his amendment. We will, I think there are people probably out in the hallway who are waiting to come in. Thank you. We're just going to take a couple of seconds as the people leave and then the other people come in. I know there are people waiting out there to come in. Yeah. Okay, good morning. Representative Burt, welcome to House Human Services. Just, you didn't have to go far, so. Right. So committee members, we have an amendment from Representative Burt. It's under Katie McClynn's name on our website. And Ledge Council will be here shortly to kind of review the content. And Representative Burt here is here to review his amendment. So welcome.
Taking time for me in your break time, so appreciate it. Yeah, so the amendment is,
Well, we all have it, so
Yeah.
you don't need to, maybe you could just describe, Representative Burt, like why you want to, you know, what's causing you to bring the amendment?
yeah, so well, first of all, the first part, it says it's a strike all amendment. It really just adds one number to the part, and you all saw that. Not making any changes to the first part in part C. What the amendment adds is a disclosure to the patient that the healthcare professional is immune from damages associated with the recommended immunization itself. So we want to just make sure that the patient is aware that there's an additional immunity for the healthcare professional. And why that's important is I'm just going to read because I can't read my notes, but so I'm trying to. H545 provides framework for the state to provide recommended immunizations apart from certain federal guidelines. In so doing, it is important to establish how that affects liability for the healthcare professional, which the bill does. The bill does not, however, address the reallocation of risk that is inherent to establishing immunity for the healthcare professional. The patient inherently takes on greater legal risk from this bill. Because of that, it is essential that a disclosure regarding the immunity of the healthcare professional be given to the patient before administering the recommended immunization. I actually wrote that myself. Did not pull that off of.
No ChatGPT or Gemini. That.
I'll send it to them.
I know.
Yeah.
There's some intelligence. Yeah, so I just want to make it clear to the patient that this is an additional form of immunity that this bill is introducing for the healthcare professional, which I think is wonderful. Just making sure that the patient knows that there's an additional immunity there. So there, from what I see legally, there is a shifting of risk that happens when you grant immunity inherently. Some of that is going to be on the patient. So I think it's important to disclose that to the patient. And I know there's another Title 18 that does informed consent, but it says nothing about their liability of the health professional. So I think maybe some updates to that should happen. I actually have a bill in health care about a small update to the bill of rights, but I think there's room for some other updates. And it specifically talks about treatments in there. I don't know where, I'm assuming recommended immunization being administered as a form of a treatment. But I just think, given the nature of what this bill is doing, that it's important that right where it talks about immunity for the healthcare professional, which I said I think is a good thing, it also makes it clear that there's a reallocation of risk, and therefore there needs to be more information and disclosure given to the patient. Yes.
And I'm just curious if you're familiar with the federal program that individuals can access, if there's an adverse reaction.
I am, yeah. Are you specifically talking about bears?
Mm-hmm. Yeah.
Yes.
Thank you. So questions from the committee. Okay, so I saw Representative Cole first and then Representative Bishop.
Thank you, Bedford. Are there any other parallels, to this strategy in other areas of like medicine or healthcare, do you think?
With medicine and healthcare, I'm not sure, but I mean, any certainly in contractual legal framework, that's a term like contractual reallocation of risk. So bear with me if I'm going to use the example of somebody who sells cars. I don't want to have that be a comparison with a patient, but if someone is selling cars, it's important that they inform the buyer of what the warranty entails, so forth, and the buyer signs on to that. in a contract when they purchase the vehicle. If we make a law that says, well, we want to make it easier for, say, we want to make sure that cars are easy to buy and sell in our city, so we decrease the amount of liability that could potentially be on someone who's selling a car. Then it's important that in our statute, in my mind, that we also make it clear to the buyer that they're assuming more risk by purchasing the vehicle because the seller has less liability. Does that answer your question? Is that where?
If you have a follow- if you have-
I'm not
if you
saying
have a follow-up, go
I
ahead.
don't know
So just-
exactly where that
sure.
lands in the realm of
Yeah, so this,
healthcare and,
yeah,
but
so.
that's where it's coming from. So it does land in the realm. I'm specifically looking at this specifically for its legal nature in any
Yeah.
statute, whether that's has to do with healthcare or with selling a car.
Yeah, so trying to interpret from the language, so would you envision this being like just a form or
I think it'd be a very
a sign?
quick statement, a short statement that says that I don't know how to work that. It's in my amendment. It refers to what's it, Part A? I don't remember.
Similar to maybe like a prescription when you get a sheet of paper with the packet?
Yes.
Yeah, okay. Thank you.
So just a disclosure of the immunity that's worded regarding what's in statute here. And then the patient would sign that, along with the extra information to do with potential harms and risks associated.
I was gonna say, I was just gonna ask you if you might address that, because it's not just notification of the physician immunity that you're addressing in the amendment. So could you speak a little bit to that?
Yeah, so it's basically it is looping in Title 18, which we already have, but doing it, making sure it's specifically with regard to immunization. And in this instance of recommended immunization. I'm kind of curious as to how, being that this is it seems like the nature of creating this bill is to provide another framework for creating recommended immunizations separate from federal guidelines. Is that
In
accurate?
addition to,
In addition to it, okay, so being that it's in addition to the guidelines recommended by the federal government, I just see that it is important to establish both the fact that there's additional immunity that's being added, that's not, I'm guessing isn't found elsewhere in our statute. And that therefore, there are also recommended immunizations that I think it's also good to have additional language about informed consent in the instance. I'm assuming, and maybe you've had this discussion, I haven't watched any of the testimony, been fairly busy, but one question that I have is, given that these are additional guidelines, and there's added immunity for healthcare professionals, I'm wondering if a patient were to be harmed by the recommended immunization, will it still go through the same process that
yes,
all the federally recommended
Yes.
immunizations will go through?
yes,
And you've had, I guess you've heard now.
yes, we've had customers.
Excellent.
Yes.
Okay,
That's,
that makes me feel much better.
yeah, I thought it might. Representative Bishop?
Just getting to this point of the interplay currently, as I understand it, federal requirement is to provide the information, but it's about the adverse effects, et cetera, from an immunization. But there is not a federal requirement that there be a sign off by the patient for the receipt. And there is already federal liability protections for the providers of the immunizations. And this is just continuing that. And again, at the federal level currently, there's no requirement that a patient acknowledge shift of liability. So those parts of this bill are really just maintaining the current federal practice. So why do you see a need to change from that aspect of the current federal practice?
But I see that the bill inherently is a change from the current federal practice. So I think as a state, that it's important to make sure that we're making sure we dot our i's and cross our t's with regard to how we are related to the patient in this case. I think it's a shifting reallocation of risk onto the patient in addition to what the federal government is currently doing. Because the patient is receiving an immunization that may or may not be in line with the federal guidelines in that time. I think it's also important to do that for the sake of the healthcare professional, this signed document. In addition to what the patient's getting.
Okay. All right. Thank you, Representative Burt. We appreciate you being here and fitting it into your schedule and everything is so appreciate.
Appreciate you fitting. Thank you.
Of course. Katie, could you come and just sort of review what we think that we're reading here?
Do you mind if I stay?
Oh, you're absolutely welcome. Yeah, no, have a seat. Okay, no, that's all good.
Okay. The amendment. Katie McMahon, Office of Legislative Counsel. So we're in section 2 of the bill. This is the section of all new language, and subsection C is the immunity from civil and administrative liability. So this subdivision C1 is what is in your bill as just C. And then the new language, this amendment is adding subdivision C2, that prior to prescribing, dispensing, or administering a recommended immunization, a healthcare professional shall provide the patient, or if the patient is a minor, the patient's parent or guardian, with written information disclosing all potential harms, risks, and side effects associated with the recommended immunization, and provide disclosure of the healthcare professional's immunity pursuant to subdivision 1 of this subsection. So they're disclosing the fact that they have this Vermont specific immunity, and they're also disclosing any harms, risks, side effects associated with the recommended immunization that's being provided. Prior to administering the recommended immunization, the healthcare professional shall obtain written acknowledgement of receipt of the information required pursuant to this subdivision from the patient, or if the patient is a minor, then the patient's parent or guardian. So sort of a new step in the provision of recommended immunizations is after having that conversation or providing that information, that the healthcare professional would have to collect a signature that in fact they have disclosed about the Vermont specific immunity and any risks, side effects, harms, potential harms associated with the recommended immunization.
Okay. Yeah, go ahead,
So
Representative Meyer.
just help me out for 1 second, because it seemed like things were getting complicated. So more or less, this amendment is all it's really doing is just help ensures that patients and people are receiving clear information about the potential risks, and they're receiving that information and just acknowledging that they're receiving that information in a nutshell.
This is saying that there's 2 pieces of information that have to be provided prior to the administration, and that there has to be a signature acknowledging that that information has been delivered to them.
So it's not restricting any access to any immunizations. It's not interfering in any way, shape, or form with any clinical judgment already being provided. It's strictly, I go in and I'm looking to get an immunization. The provider says to me, hey, I want to give you the information on the risks and potential side effects of this. Could you sign this waiver acknowledging that you've received that information?
The person would still be allowed to receive a recommended immunization if their provider is, if it's appropriate for the patient to be receiving it and the patient wants to receive it. Yes, the provider would have to give this information first and then collect a signature.
Thank you.
You have a question, Rep. Norris?
Possibly you go first.
Okay. Katie, are there provisions for informed consent or consent in that exists in statute already?
Oh, let me pull up the statute. Right now, under federal law, there's like a information packet that's given out to somebody before they receive an immunization that has the different health effects. Let me see. You have it. Okay, let me stop sharing and put my statute up.
Okay, sorry. And while Katie's doing that, I just want to let our next witnesses know, we're probably going to take a short break in between, if that's okay. So just so you can plan your stand-up time, or you can get another cup of coffee, or, Okay. And just want, so people know the process, we're not going to be voting on this right away because we have a witness from House Judiciary, but is not able to make it here right now. So there's going to be, we'll vote on it before we get to the floor this afternoon, but we won't be voting on it right away, just so you know.
Just so you know.
Question? No, I've been done.
The original question was the current statutes on consent. You can unfold that chair that's there if you want to. Okay.
We'll just keep asking.
I thought that this Lori.
But that's another day.
That's not
Not even here.
No,
Not
it's
even
not
here.
another day.
No. Yeah.
That's something.
Katie, it's something you can also come back to.
Okay. I don't have something at my fingertips.
No,
Yeah.
but that's what and like I said, we're gonna, because we have other witnesses and, we, have other witnesses on this bill as well, or in this amendment, you can come back to that question. Okay. Or the answer to that question.
Okay.
Okay, anybody else have any other questions for Katie right this moment?
I do.
Yes, go ahead,
So it
Representative
seems to me
Eustace.
The crux here is, I mean, I'm reading about informed consent and how that works in here in the state, but it seems like the crux of this amendment is getting a signature. That's the issue.
It's, sorry, I didn't mean to
No,
interrupt.
no, so I don't know if that's already in statute somewhere, if there's a provision for that.
I would say that it's not just getting a signature. I feel like it's twofold because it is having a conversation about this immunity provision, which is not currently required. So it's not just the signature, it's having the conversation about any adverse effects and the language about immunity in statute and then getting the signature. So
I see.
I want to be clear that it's not just a signature, it's additional information that would be part of the conversation prior to getting an immunization.
And, I'm just gonna ask, and is, okay, I'm not gonna ask that. Go ahead, Representative Dwyer.
I see, okay, I see now. Yeah, so it, literally, this thing is requiring and mandatory, requiring the individual is receiving the information, they must sign the form. Is that what I'm also, okay,
Yeah,
all right. Yeah, okay.
go ahead, Representative Noyes.
And how does this like, do they have to like understand it or can they come back to the medical professional after and say, I didn't really understand what I was signing? And could that have an impact on their insurance or whatever? I mean, does it open for more? Do they have to understand? Like,
Yeah.
Not under this.
They have
Hopefully
to,
not.
the language is obtain written acknowledgement of receipt. So that isn't a statement of understanding. It's a statement of the information has been provided to them.
So they don't have to understand it. We're gonna have one more
Yeah.
question for Katie, and then we're gonna move to General Counsel for the Department of Health, who is,
Yeah, no, then I'm
We're
good,
also-
because I have more of a statement, but that can wait till it comes.
Okay.
Same with
to
me,
vote.
yeah.
okay, yeah,
Thank you.
we're gonna have more discussion. So, any other questions for Katie? Thank you so much for popping in, Katie. I know you've got lots of things on your schedule. Okay, and now, Lauren Lehman's gonna, join us. All right, just remind, I just said it, but just remind people who you are.
Absolutely, thank you. Well, I'm Lauren Lehman. I'm the General Counsel for the Department of Health. And thank you all for having me here today. A helpful conversation. So I want to kind of take a step back to the liability protection and remind folks that it is very narrow. So it is just for gross negligence or any adverse reactions to the vaccines that are administered exactly in accordance with the recommendations from Vermont. So because that's so narrow, it's actually narrower than what is on the federal level at this time. The federal level right now, any recommended vaccine, any vaccine injuries, they're capped at any of your damages at $1,000 in civil court. Anything above $1,000 in damages, you need to go to the Vaccine Injury Compensation Program at the national level. That protects both providers and drug manufacturers from liability. Gross negligence protection. That is not the case here. We can't recreate that on the state level. We have narrowed it. So the shifting of risk is actually more towards the provider here, and not toward the patient. Because the risk liability protection is narrower for the provider. It is just for gross negligence and just for injuries related to the administration of the vaccine or prescribing the vaccine or dispensing the vaccine in accordance with the state recommendations. If there's discrepancy between state and federal, as you've all seen in this bill, there's going to be a lot of back and forth with experts in the state
experts on the national level about vaccine science, about evidence-based and scientifically sound recommendations. So to the extent they're inconsistent with the federal level, and the federal level recommendations will also inform the state level recommendations. To the extent that they're inconsistent, that science will be available. It'll be a scientifically sound recommendation. Right now, the federal liability protections have not changed. So right now, even if the state comes out with new recommendations, the ICP with the national liability would provide broader liability protection than the state law.
So I want to be clear because one of the previous witnesses, the sponsor of the amendment, really is trying to have protections for patients with the belief that this was creating more risk for the patient. So I personally don't see that, but I am interested in your opinion about whether or not this creates more risk for the patient.
I disagree with that statement because right now, the national program provides much broader liability protection for providers and pharmaceutical manufacturers. Should a vaccine not be included in that national program, this is very narrow, right? This is just to a provider followed state recommendations, scientifically sound evidence-based state recommendations. In that very rare 1 in a million chance somebody had an adverse event happen from the right dosage, the recommended schedule, the recommended vaccine, and then that the provider themselves is not going to be held liable for doing exactly what the state recommended and what the science recommended and what evidence base is out there. So that's actually much narrower, and the shift is to more liability for the provider than for the patient.
Okay. Other questions for Ms. Lehman? Yes, go ahead.
So what you're saying, the amendment as laid on out, and again, reading the amendment, it's asking that the provider provide to the patient, parents, clear information in regards to potential risks and side effects of the vaccine, disclosing that information, and then requiring the patient to mandatory, which I'm going to go away from that, sign off that they've received that information.
Thank you. And now, I'm sorry.
So therefore, I'm kind of losing track to where we're talking about like, okay, all of these liability risks, and I'm trying to bring it back around to get clear understanding in which is being requested with the information, and that being, here's the information, if you would sign off on this consent.
Yeah, absolutely, and thank you. And I agree, there's two components here. One is that liability disclosure, and then there's the potential risks, side effects, and harms. And I'm gonna nerd out on one word, potential. Because right now, in the current law, it's 12 VSA 1909, healthcare providers in Vermont are subject to malpractice, medical malpractice, if they don't disclose the foreseeable risks, harms, and side effects of a treatment or procedure. So, and that would not be protected under this liability protection because that's not an injury in accordance, from that routine schedule. Yeah, if a provider failed to provide that informed consent to a patient under current law with no changes, the foreseeable risks, etc., then they could be subject to malpractice insurance is considered battery under the law, or malpractice liability is considered battery. So that is current law. The risk with the potential harms is that term is broad and vague. And so if I'm a lawyer, if I'm a physician, I'm assuming real risk there, and it creates barriers to access when physicians are afraid, because what if there's some unknown potential risk out there that they don't know about yet, it hasn't been published in the literature, and they fail to disclose that. And then also there's a lot of associated but not caused
adverse events or incidents or side effects. Somebody might get sick 3 days later and it's not related to the vaccine, but they can report that to the adverse event system. They can say, hey, and it's not verified, there's no verification requirement. So then is that a potential risk, harm, or side effect that they have to disclose? And if they do that, that can create unwarranted fear and misinformation in that immunization space. So we don't have specific informed consent requirements for much riskier medical procedures and treatments out there. And there's been a regular choice to really rely on the language in 12 VSA 1909 to say your obligation as a provider is to know what the foreseeable risks are. Foreseeable, you've heard about it, it's known, it's verified, to disclose those to your patient and not only that, but to do so in a way that the patient understands. So there's a requirement that you do so in a way that makes that patient understand. So our concern with adding additional language is not only that it's vague and broad, but that it will create barriers to access and it will create barriers to and confusion and incorrect information out there that's not verified. We'd rather rely on the system.
Thank you.
Thank you. Just a second. So, just as an FYI, Katie, found the information that I was asking about and, she'll, summarize that for us, when we're done. So you can understand a little bit better what exactly the state law currently says. Okay, go ahead, Representative Bishop.
If this amendment were to pass, bill with it was to pass, and doctors were required, or providers who give immunizations were required to disclose the liability aspect of this, the shifting liability as it's referred to by the bill sponsor. And the patient asks questions. Do you feel that the practitioners giving immunizations are well suited to provide legal advice on what the liability means?
Maybe there's some doctor lawyers out there. Yeah, I would imagine that they would, no, I don't know. That's a good question. I don't know. It's obviously nuanced.
Okay. Thank you. Any other questions for Lauren? Okay, so what we're going to do now, Katie had to go to Ways and Means on this bill. They're doing a drive-by. It's a very popular bill in the building. So Lori is posting the section of law that Katie found for us, so you can read it for yourself, but then Katie's going to come back and provide a summary of that for us when she's done in Ways and Means. So what we're going to do right now is to take if we could come back, slightly less than 15-minute break, like 25 of, that'd be great. And thank you for being